Good morning, everyone, and thank you for joining us for today's campus update briefing. Today, Dr. Robert C. Robbins, president of the University of Arizona, is going to provide important information on the university's current operating status as we head into Family Weekend. He is joined by Dr. Richard Carmona, 17th Surgeon General of the United States and distinguished professor here at the university. He will provide updates on the current state of the Delta variant and our public health conditions in the county, state, and here on campus. And we are extremely excited to welcome Dr. Terry Cullen back to the briefing. Today, she will talk to us all about the booster shots available and the current conditions of the Delta variant and COVID here in Pima County. We'll take media questions at the end of the briefing, so please make sure to type your name and news organization into the panel when you raise your little virtual hand, and I'll call on you in the order I receive them. I'll turn it over to you, President Robbins.
Thanks, Holly, and good morning. Thanks to everyone who's tuned in today. And thank you, Dr. Cullen, for joining us again. It's been too long, and we're really happy to see you here today. Also, I've talked to a lot of people. Family Weekend is this weekend. There'll be a lot of people here on campus. And I continue to hear, Holly, I have no idea how many people actually log in, but a lot of people are telling me that they really enjoy this weekly briefing. They derive a lot of knowledge and like to hear the updates because I assume we just kind of talked amongst ourselves and nobody was really listening. But I'm appreciative to everyone who works hard to put this briefing together every week, and for all of you who tune in. I'm glad to hear we're providing a little bit of information and updates, and I think it's important for us to keep everybody to communicate with everybody and keep everyone updated about what we're up to. Today, Dr. Cullen will comment more in a moment, but right now I want to begin by noting how well the Pima County Health Department and our entire community has done to keep COVID-19 transmission to a relatively low level. This is due to large part to our high vaccination rate, now exceeding 75% of Pima County residents who are 12 years and older who's gotten at least one shot. Now, fully vaccinated, we're more in the 60% range, and maybe as Dr. Cullen and Dr. Carmona engage in a discussion with this Delta variant, as we've been saying on this briefing, we probably need 85–90% of people vaccinated. So we'll continue to stay with our mantra. If you haven't been vaccinated, please get vaccinated. As you all know, we've been concerned about the impact of the Delta variant, and it has caused an increase in new cases in Pima County. However, we fared well compared to other regions with an RT value below 1. And of course, that's the number that we continue to watch around how transmissible this virus is. For the past several weeks, it's been below 1. This week, it's at 0.93. The best way to continue improving our public health situation is just to get vaccinated. If you've not already been vaccinated, please get vaccinated. Continue to wear face covering in public, regardless of your vaccination status. And we'll get into a discussion about the other mantra about testing when we invite Dr. Cullen to join our discussion. If you've received a second dose of the Pfizer vaccine at least 6 months ago, you also are recommended to get a booster if you fall into one of two categories. You're 65 years of age or older, or you're between 50 and 64 years of age with underlying medical conditions. Obviously, talk to your healthcare provider for better definition if you have an underlying condition that would qualify you for a booster. And I'll just stay with that until we start our discussion about boosters. For students and employees in these groups, Campus Health is now offering Pfizer booster shots. Visit the website address on the slide for more information. Both Pfizer and Moderna are available for initial doses as well. So if you haven't been vaccinated, we've got vaccine for you. If you have been vaccinated, please come back and get your booster if you fit into these categories. If you're 18 to 49 and have underlying medical conditions or may be at increased risk of exposure due to your work or living situation, you may also benefit from a booster, and you should talk to your healthcare provider and consult with them. The university is also holding clinics for seasonal influenza vaccine. As Dr. Carmona has said many times at our briefings, the onset of the influenza season adds another challenge for our healthcare system. And I encourage all of you to get a regular flu vaccine, a flu shot, to minimize the influenza impact. I also want to note that there's continued growth of our takeaway testing program. The number of tests provided through this program continues to increase, which illustrates the continued interest in this convenient option. We now have 13 locations in Tucson, and as I mentioned last week, several in other cities and towns around the state. Results from Tucson-based takeaway testing usually are available the next day, and at other locations, return results within 2 to 3 days of drop-off. Visit arizona.edu/takeaway testing for more information. arizona.edu/takeaway testing. As always, we continue to offer in-person testing at the Student Union and North Rec Center in Tucson. Finally, I want to remind everyone of the mental health resources available to members of our community. The pandemic has taken a toll on each and every one of us. No one's escaped the stress and the mental health effects of this pandemic. And it's important to acknowledge the impact of our mental health and well-being for each and every one of us. Social connections can definitely help, and they're vitally important to maintain, whether through remote options like phone call or Zoom or in person when done safely. Professional mental health providers also play a key role, and they are an important resource offering expertise, experience, and guidance that our friends and our family may not be able to provide. If you're in need, I strongly encourage you to reach out. Students may contact counselors and psychology services. Employees can contact Life and Work Connections. You also may be interested in the university's events and public resources focused on compassion, a really important value for the University of Arizona and a vital practice for all of us in the midst of the challenges we faced during this pandemic. The College of Social and Behavioral Sciences Downtown Lecture Series is focused on compassion this year. And this is an incredible lecture series. For those of you who haven't been to it, it is simply tremendous. And Dean J.P. Jones does an outstanding job putting a program together each and every year. And this year, the focus is on compassion. So thank you, Dean Jones, for that. Its Center for Compassion Studies offers additional events year-round. So seek out SBS's Center for Compassion Studies, because in addition to this Downtown Lecture Series, which is really fantastic each and every year, there are events that happen year-round. Thank you again for joining us. Dr. Carmona and Dr. Cullen will now offer their thoughts. And I think, Rich, we start with you, and you can cover the data and the slides. And then Dr. Cullen, again, thank you so much for joining us. We're always enhanced by your presence and the comments that you make. So thank you for being here.
Thanks, Bobby. Appreciate the remarks. And again, to everybody who tunes in weekly to be with us, thanks very much. As the president has said, it's been remarkable, the great feedback we've gotten, probably because of Bobby's charisma, that has linked us to the community, but really has made a big difference in us being connected with the community. And to Terry Cullen, a friend, a colleague, a partner, boy, you couldn't ask for a better a professional and a leader to work with us to make sure that we keep the transmissibility down, get people vaccinated, and do all the public health mitigation strategies. So we've been very fortunate, Bobby. Let me have the first slide, please. As you know, every week we review some of the averages and kind of just give you a snapshot on a weekly basis of where we are and how we're doing. And you can see overall in Arizona, we're ranked 26 nationally. At Pima County, 35 nationally and 26 for Pima County. So we're doing relatively well. But as I emphasize every week, and I know Dr. Cullen is going to talk about this as well, we shouldn't get complacent. Yeah, we're doing a little bit better, but we're still in a high time of transmissibility. So we watch these numbers to watch the trends, not a specific day and a number on a specific day. So overall, doing okay, but still we're not out of this yet. And as you've heard, we've got a long way to go with vaccination and boosters. And the fact is that we're still transmitting a lot of disease in our community. Next slide. You look at the testing results, we're pretty happy with this because our positivity rate remains low. Even as the amount of testing goes up, we expect the testing will continue to go up. The president has been pushing that, rightfully so. And as long as we keep those numbers down, that's a good sign that we don't have that much transmissibility, but nevertheless, the numbers tell us a different story with significant amount of cases within Pima County and within our zip code at 85719 and the University of Arizona. Next slide. So as you can see here, the RT values that we speak about on a weekly basis, that is the transmissibility numbers, staying below 1 is really ideal. And we've done that. We bumped up a little bit over 1 in the recent past, but we're back down to, I think, a reasonable number. But again, we're not complacent. We want to keep pushing that down so that we extinguish all transmissibility as our aspiration. Next slide. Look at the vaccination rates, which are really terrific for our seniors, pretty much pushing 100%. Total Pima County at 66% and ages 18 and above 17. Now state overall 58%. And I know Dr. Cullen will talk a little bit about this because there's some confusion out there. When you see the numbers, you have to read carefully. Are we speaking about all totally vaccinated population or people who have just received 1 dose, for instance? And sometimes the public gets confused with that. Certainly, we're happy that a lot of people have at least got 1 dose, but we want to make sure they get that 2nd dose and the boosters if they are in the cohort of people who are required or requested to get that booster. Next slide. So if you have any questions, as we speak about weekly, the Ambassador Team hotline, phone, and email 7 days a week, please give a call. Send an email for any questions you may have. We realize that these are really complex issues. As we've said many times on this weekly broadcast, the science changes every week. So we will give you new information every week, every other week as we get it. But as I remind everybody frequently, and as the president has, a year and a half ago, we hardly knew anything about COVID. And now we've become experts. The average citizen has become kind of a citizen epidemiologist and using language they never knew before. But the point here is that we understand still the complexity of this issue, especially for the non-health professionals. And there are legitimately a lot of questions. So give us a call or send an email in, and we'll do everything we can to answer your questions. Next slide. So at this point, I want to turn it over to Dr. Cullen. And again, Dr. Cullen has just been an extraordinary partner. Had the privilege to work with her over many years in the federal government, where she's a career public health officer and flag officer. And we were fortunate to attract her to Pima County, and she continues her leadership there and has been a great asset to all of us. So Terry, take it away.
Well, thank you as always. I've missed hanging out with you guys at these press conferences, so I really appreciate the offer. So I just want to give you a brief update on where we are in Pima County. This really is consistent with what the president and Dr. Carmona have shared with you. Let's start initially with cases. So, we're in high transmission. That means we have greater than 100 cases per 100,000. You can always think of Pima County as 1 million people. That means we have more than 1,000 cases a week being reported right now. The reason why this is concerning is that the impact of having high transmission not only affects the individuals that are affected, but it affects our healthcare system and our public health system, our ability to respond in a quick and appropriate manner. Our goal is obviously to be in low transmission, and you will recall we have been there. We have been at times less than 50 cases per 100,000. Now, we know that this has cycled, and if you go look at what we call the epi curves of where we've gone up and where we've gone down, we're not anywhere near where we were in the middle of the winter. You'll recall January and February, but we're still way too high. On the plus side, we are doing better than Arizona overall, significantly better than many of the other counties, which are close to 270 cases per 100,000. So if you think about that, we're on the right path. But what I would say to people is what we're seeing is some bumping. We're going up, we're going down, we're going up, and we're going down. And we're doing that within about a 10 to 20 cases per 100,000. What we really want to do is be on this downslope, and we're anticipating we're going to get there. How are we going to get there? We're going to get there with vaccinations. And as you heard from President Robbins, as well as Dr. Carmona, this is a very critical part of what we would call the epidemiological response. We really need to get at a higher rate of vaccination. And I realize for people this is confusing, right? Because there was a time when we talked about herd or community immunity and said, oh, if we get to 70%, we'll be fine. You see numbers where we are now and you go, well, why aren't we fine? I would remind people that Delta variant has happened. The Delta variant has higher transmissibility. That means more people get infected if an individual has that. And so what we need is a higher rate of vaccination. Dr. Carmona talked about how these numbers are really confusing, and we understand that. What's important to note is that there are really positive things in Pima County. If we look at those who have been vaccinated that are 12 and over and those that are 18 and over, those numbers are almost the same. What that means is that when vaccination became available for the 12 to 17-year-olds, we saw very significant uptake of immunization in that age group, critical as we move forward. And as you saw, also, our 65 and over community has done amazingly well. They really are at 96% first vaccine, and they're at almost 87% for a complete series. Obviously, we need people to have the complete series. And so that number right now for 12 and over is approximately 67%. If you think about that, we want to get to 90, we still have a way to go. So we really urge people and somewhat plead with you to make sure that you get vaccinated if you're able to get vaccinated. Let's talk briefly about boosters. Dr. Robbins shared with you the guidance for boosters. If you are part of the university campus, and we're always grateful for our relationship with the university, you will have the availability to get boosters on campus. For those of you who are not or seek an early booster, we actually opened up our Abrams Pima County Health Department today to almost a full booster place. So please seek care there. You can go to the Pima County vaccine website, and I'll show you where to go. In addition, the pharmacies and the clinical providers have been wonderful partners, and many of them have made available vaccination boosters. So if you fall into those groups, please seek a booster. I would remind you that we're not double checking, are you immunocompromised? Do you fall into this group? This is what we call a self-attestation. The individual indicates that they fall into that group. There's not a question. You don't need to bring a medical record with you, and you will have access to the booster. Once again, the boosters are provided by the federal government. They are a federal asset. So at the county websites, there is no charge. People can come in and get boosters. Finally, I want to talk really briefly about testing. I do agree with Dr. Robbins. At some point, testing should be ubiquitous. It should be available every day. I do want to let people know, as you may have seen, however, that the county has limited testing. And the reason for this is driven by many things, fiscal constraints that confront the county. But we also want to make sure that the people that need testing that have been exposed and or are cases can access testing. We're also working closely with the K-12 schools. We have home testing available there. We have on-site testing available at almost all of the school districts. The district superintendents have been wonderful partners. So overall, if you look at where we are, our case number is too high. We need to work on that. The way we work on that with vaccination, if you've been exposed or you're worried, please seek out appropriate testing. If you're in a K-12 situation, you can get testing at almost all the schools, including public, private, parochial, and charter in the county, and we look forward to our ongoing wonderful engagement with the university. Thanks for the opportunity to speak.
Thank you, Dr. Cullen. Hopefully you can stay around and we can have a little bit of a discussion, but I think we've got lots of questions. The last few weeks, we haven't had many questions, but with your appearance here, it seems the press has come out. So hopefully you can stick around. One thing I would say is, we all look every night at the numbers. And you would hope by this point, we would not be seeing the number that's at the bottom of our feed every night, which is how many people are dying, continue to die. Now, the vaccine is not a panacea, but is definitely better than what we had a year ago. If we think back a year ago, we didn't have the vaccine. So I guess I'm struck by, we still have, 3, 4, 5 precious souls who are dying every day from this. And I think that sometimes gets lost. The other thing is that, I'm reminded every day of how many resources we're putting toward this. And therefore, we're not putting resources toward cancer screening, cardiovascular screening. People are delaying getting their routine colonoscopies or mammograms or stress tests or whatever they're going to be doing. And of course, as we've said before here, this just puts a bright light on the health disparities that we have in this country and certainly in this state. So, there are many reasons why we want people to get vaccinated. Number one, I just don't want people as they, are about to get an endotracheal tube put in, go, yeah, I wish I'd have gotten that vaccine. Get it now. Just do it. I understand that, people have their liberties and they have their choices, but this one, pick something else. This one, you could end up on the wrong side of this. And I'm just reminded about every night I still read there are several people who are dying from COVID-19. It's better. There's no question it's better, but I just want to bring that up. And then the other thing to highlight what Dr. Cullen said about the quote, community or herd immunity, it has definitely got to be higher with Delta. And I can remember the first discussion that Dr. Carmona and I had about this. He said, you do know this virus is going to mutate. I go, yeah, I can't even think about that now. Rich, that's almost 2 years ago. And I don't think any of us realized how contagious and transmissible the Delta variant was going to be. It's not as, it doesn't make you as sick, but it is certainly much more transmissible. And we could have gotten on top of this had we gotten vaccines early on. We sound like old people, which we are, about going back to, I remember polio. There was just never this rancor about it being a political issue. We were just so happy that somebody invented a vaccine and they were coming to our little town and giving us the vaccine and saving us from this deadly disease. And the same thing exists here. So I'm going to stop there and let the two of you talk, because I've gone on too far ranting and raving about, I just don't get it. Why we make this such a big deal about politicizing it?
Well, Bobby, the missed opportunity, I think that you say, and you and I have spoken about this quite a bit, is that at a time when we are effectively at war with an invisible invisible virus that is killing us and harming us, we should have come together as a nation as one, not as political parties and disinterested groups and so on. And we failed to do that, and we're paying the price for that now with a nation divided politically and otherwise, when we should have united as one, just as if we were attacked by a foreign enemy and we came together as Americans. And unfortunately, that's the facts, and you've laid them out. So, Terry, again, thanks for being with us, and give us your thoughts.
Well, I want to focus on the death a little, Dr. Robbins, because I don't think any of us, and you mentioned compassion and this need for well-being. And what we know is there's been over 700,000 deaths in the United States, a very significant number. And almost every day we are reporting deaths in Pima County. Most of us, and my mantra was, we all know somebody who knows somebody. I think as the deaths increase, we all know somebody who has died or had significant morbidity or long COVID right now from this disease. So the impact of this is tremendous, both emotionally, spiritually, physically, and also from a community, from how do we begin to recover and ensure that we are resilient as we go forward. That's a commitment from the health department to work with the community, to work with the university to make sure we get there. I would remind us, and I'm so glad you brought up compassion. Compassion is not just for ourselves or our families, it's really for our community at large and for this amazing health inequity and disparities that COVID has once again revealed to us. And the one other thing, and Rich, you talked about this missed opportunity. Not only are there missed opportunities for vaccination, but from a public health perspective, and it goes to what the president was talking about, there's missed opportunities to keep people who have not been directly affected by COVID well, and to make sure that we can also respond to the other public health epidemics that are in our county right now. Fentanyl overdose, you've all heard about this, congenital syphilis, increase in HIV rates, these kind of infectious diseases that we should, and behavioral and mental health diseases that we should be able to combat. And instead, not to say we're not addressing them, but we are addressing them with constrained resources because of the impact of the pandemic. Thanks.
Okay, Holly, if we don't fill all the time with questions, but my sense is there'll be a vigorous discussion about the questions, then we can come back and hit some final points at the end.
Okay, so our first question comes from Catherine Palmer at the Arizona Daily Star. And she wants to know, President Robbins, you've said you would require vaccines if the state law allowed you to do so. Now that a judge has ruled the state's ban on colleges and universities requiring proof of COVID-19 vaccination unconstitutional, does the University of Arizona have any intention of requiring students and staff to show proof of vaccination? Why or why not?
Yeah, that's a good question. I would say this, and I don't know all the issues, but I think the Attorney General challenged that or filed an appeal or something. Look, what I would say is, I think they're going to be, this landscape is moving very quickly. And what we're doing right now at the university, I think, is working quite well. The number of cases we're finding is low. The well-being of our university population continues to be at an acceptable level in terms of no one's getting really sick and ending up in the hospital, even though there are people who are ending up in the hospital and in the ICU, and as we just talked about, even dying. The vast majority of those people are unvaccinated. Now, obviously, you can find cases that are fully vaccinated who have a breakthrough Delta variant, who have many comorbid conditions, and they end up dying from this. It's just enough to tip them over. But for the most part, it's unvaccinated people. We do know, and we didn't cover the numbers today, but we do know that over, I think it's 60% of our students have voluntarily downloaded their proof of vaccination, number one. And I think that number is probably more like over 80% in our on-campus residential dorms. Faculty members is more than 50%, but my sense is, and I don't have the data to prove it, but my sense is that this number is higher in both groups for vaccination. But it still doesn't address the question of why not now? If we've got an opening, why not mandate? We discussed it at our ABOR meeting just this past week. All three of the state universities and the ABOR board, the Board of Regents, we all had a discussion, and we agreed that we would hold tight with what we're doing right now. All three universities are doing a phenomenal job of encouraging and engaging in the university communities to get vaccinated, doing robust testing, and when we find positive cases, isolating them in isolation rooms. So for right now, I think my position would be, let's just wait, let all this play out, because we're doing a great job right now. Everyone is doing their part, and for the most part, classes are going well. We've got sporting events, on and on and on. I will note, though, what is it? It's October 4th. I'm waiting to see what happens. I think the date is sort of October 15th timeline, about how the federal mandate will play out, because we're a large university who is very, very dependent on federal funding. And if the federal government tells us that if you take any of our money, you got to be vaccinated, I think that's that may be a tipping point for us, because and then it gets into the policy people and the lawyers will have to tell all of us at the universities, well, does the federal requirement supersede anything that the government of the state does? And I think it gets into federalism versus states' rights. And for right now, I think we just hold tight. We continue to encourage vaccination as much as possible, and testing, even if you're vaccinated. Continue to cover your face, wash your hands, stay away from people as much as you can. All the things we've been saying. And then we'll get into these policy issues as they become more clear to us and this plays out. I think that's about as good as I can do. And I certainly would invite Dr. Cullen and Dr. Carmona to amplify anything I said.
Terry, go ahead.
People need to get vaccinated. Obviously, our hope is that this does not require a mandate to do this, and that we can drive this through science and individual and community-based decision. This whole concept of community normalization, community norms, what does a community do? Pima County is a pretty amazing community. Our numbers, I didn't mention this, are significantly higher than most of the other counties in the state. So we know people have been responsive to data. From a county perspective, as you know, that is an elected decision, not the Pima County Health Department decision. We have encouraged that everyone who can vaccinate get vaccinated, and we will continue to do that. We have actually used data to try to show to people why that is so important. As you may know, the Board of Supervisors up to now has used positive incentives as well as now negative incentives to try to encourage our county employees to get vaccinated. Once again, however, I always, in this case, have to defer to the Board of Supervisors from a county perspective. But I believe that every tool that we have available to try to encourage, cajole, get people vaccinated is critical. Thanks.
I would add on to what Bobby and Terry have just said. My role at the university, 100% aligned with what President Robbins said, but at the state level, working with the governor now on these issues, the mandate issue just becomes divisive. And really our goal as professionals is to make sure everybody gets vaccinated and practices the best mitigation strategies all the time, period. And so, as I've said repeatedly, we should not be distracted into political distractions when people are sick and dying. Our goal is to save lives and keep people healthy. And as Bobby's pointed out, this is a very difficult challenge, because in our state, there's a big division over the individual right versus the collective right of society. And all of those things play into this. But we have to stay focused on the mission. And our mission day to day is preventing disease spread and keeping people healthy and stopping the morbidity and mortality that results from too much transmissibility. And as pointed out by both Dr. Cullen and Dr. Robbins, we're doing a pretty good job at that now, but we can't be complacent. We still have a ways to go.
Yeah, and I think in the private sector, there's some degrees of freedom that obviously we don't have as a public institution. And so, you know, our hospitals, you know, I keep saying, well, let's just do exactly what all of us have to do to keep our license. You know, we've got to get a flu shot every year. We've got to have all of our vaccination records up to date. And I know Tucson Medical Center, and then I think Banner as well by November 1st is going to require it. If you're an employee at Banner, you're going to have a tough choice to make. Either you get vaccinated or you're going to lose your job. We're not quite there yet. This thing with the federal requirement for federal funding requiring it, that one's going to be very interesting to see how we process that. But I think Rich is right. You know, having a mandate does not ensure that everybody is going to do it. They may choose not to keep their jobs or choose to go online to get their education instead of coming in person. So more to come, Holly, on this. I am going to be watching this, and we're all going to be talking about it. But it's a fair question.
Yep.
Our next question comes from Craig Smith from KGUN. Go ahead, Craig.
I'm going to, again, attempt a dual question. First, for Dr. Cullen, please elaborate a little bit on the change in testing policies. We had heard it described also as a way to try to encourage vaccination rather than folks who want to escape vaccination by just testing and testing and testing. And for Dr. Robbins, on the federal funding thing, wouldn't U of A already fall under the 100+ employee rule? So whoever wants to take which one first?
I'll defer to Dr. Cullen, and I'll come back to the other.
Okay, Craig, thanks for that question. It is an important part of our change in testing strategy. As you know, some employers are giving individual employees the option of testing routinely instead of vaccinating. What we have seen at our county, and this is only our county sponsored sites, is that we have many people coming in that are testing 2, 3, 4, 5, up to 6 times every 2 weeks. Not only is that a use of pretty constrained resources that the county has, but the ultimate goal here is to get people out of that kind of testing if they are doing it in lieu of getting vaccinated. So our push is to get people vaccinated. Because of that, coupled with the cost, as you know, which has been significant to the county for the amount of testing that we've provided, we have elected to eliminate the option for routine testing for employment and or occupational needs to be met. Now, that testing is still available in the county. Individuals will need to seek that out through other testing centers, including most of the pharmacies, as well as some of the clinical providers. So we're not saying you can't do that. We're just saying from a county perspective, our goal is to improve public health, which means given constrained resources, we are going to focus on who will benefit the most from testing, given that other people have an opportunity and an option to vaccinate. And that's also why we've made vaccinations so ubiquitous. Thanks.
Yeah, and I would just answer the part of the question about, we clearly have more than 100 employees. So we would qualify on those federal guidelines. But it's unclear when those would be enacted, what the monitoring of adherence would be. I think it's going to be placed on all the employers to do an accounting of how many employees are vaccinated. And my understanding also is that the Attorney General is saying that this is unconstitutional and filing a lawsuit to say you can't force this on us. So I think all this is going to play out in the coming weeks, and we'll continue to stay with our mantra: everybody get vaccinated. But you're seeing it even in the NBA, Craig, that even with a mandate and a requirement, there are 95% vaccinated, but there are 5% of people who are saying we're not going to get vaccinated, even if we have to sit out until this is over. So I think it's the same thing across society, and people have the right, have their personal right to say, I'm just not going to do it, and I'll adhere to whatever requirements there are for if I lose my job, I lose my job. But there's going to be all kind of legal maneuverings, and I think it'll become clearer in the coming weeks to months about where we'll be on this.
Bobby, I think worth noting what you've mentioned previously, and we've discussed how society has changed, that sociologically, when you go back to the polio days 65, 75 years ago, there was no pushback. There was no false narrative. Everybody couldn't wait to get online and get the Savin or Salk's vaccines so that you wouldn't have to worry about your child being on an iron lung. And really the beauty of it was we came together as a nation, irrespective of any political considerations. Let's just get this behind us. And we're still struggling now, which I think it's very pertinent why I bring it up again, because you've used that metaphor so many times, and it's just so important.
Yeah, it's hard enough, running the university without having to deal with this. But you know what? We're going to deal with it. We'll do the best we can. And for right now, what we're doing is working quite well.
Our next question comes from Rocio Hernandez from KJazz. Go ahead, Rocio.
Hey, I just wanted to follow up again off of vaccine mandates, but wondering if there's any interest to require weekly COVID testing also. And then like you mentioned, Dr. Robbins, there's an appeal, and this is going to the Supreme Court, so we don't know quite yet what's going to happen. But if the Supreme Court upholds the court ruling that said that the state law is unconstitutional and essentially voids it, do you think then the university would mandate COVID-19 testing and mandate COVID vaccines, as Dr. Carmona said, to eradicate transmissibility?
Yeah, I think that's what I'm waiting to see, how that plays out. Then, of course, we'll have consultation with the other universities and our bosses, the Board of Regents. But I think if there's a clear path forward for us, then I think at least my opinion on it is it would be certainly the best public health practice for everybody to get vaccinated. And I would argue to continue testing even if you are vaccinated. Now, there are certain limitations that Dr. Cullen and I have been discussing about, you can't test everybody every day. I keep saying, there's going to be a toothbrush. You just brush your teeth and you look and see, are you positive or negative? And ideally, in the, highly stylized ideal world, everybody would just test every day. Do I have it today or not? But the cost effectiveness of that is just not there. But even if we go to a mandate, there are going to be, and Dr. Cullen and I were talking about and estimating, we know there's probably 10, maybe 15% of the population, even if you mandated it and they would lose their jobs, would just say, I'm just not going to do it. I am not going to get that vaccine. So that leaves us in a public health quandary as well, because we've got to get a high enough herd immunity or community immunity status to be able to stop the mutation of this virus. The other thing is, certainly is a state entity, and this is a whole other area of the law, and I would guess it's labor law, that the exemptions are going to have to be so far-reaching, meaning they're obviously going to be clearly medical exemptions to the vaccine. I'm not really sure what they are. There's been a lot of talk about the risk of infertility, the risk of accelerating neurocognitive dementia type diseases. I can't think, and maybe Dr. Cullen and Dr. Carmona can think of some real medical contraindications for vaccination. I saw that, that only about a third of pregnant women in the country are vaccinated, and that there's the that even if you're pregnant, you should get vaccinated. And all the data that I've read and heard discussed is that the issue of infertility is not something that would be an allowed exemption, because the data is just not there to support it. I guess maybe there's some maybe anaphylactic or some other issue that would prevent people on a medical basis. So I think the medical exemptions would be very, very small. Then you get into the philosophical and religious exemptions. And, I know we've got several people at the university who've already stated, I'm not going to get the vaccine, and I'm invoking my religious freedom to get an exemption. So don't bother me about it, because I'm not going to get it, and I want a religious or a philosophical exemption. And that one's going to be really broad. And the question's going to be, I know that one of the players in the NBA appealed for a religious exemption, and they didn't allow it. But they're a private entity, not a public entity. So this stuff gets very complicated, but I again come back to, let's let all this stuff play out and see where we are, continue doing what we're doing, because it's working.
Bobby, as we discussed, this is kind of what I've come to understand and frame as the perils of living in a democracy. The right of the individual versus the collective right of society on a whole host of issues. COVID just happens to be the one before us today. And, and we hope that people see the greater good of preserving our society, our democracy, our economy, all of those things that we're worried about by getting vaccinated, because it's not about just your health. It's about our economic health. It's about a growing debt, unemployment. All of those things tie into this. And so, we hope that, and we respect the right of the individual, as we have discussed, but we are squarely on the side of, right now, the health, safety, and security of our nation because of this threat.
Yeah, I don't know. You can get drawn into these things, these analogies. I mean, do I think it's a good idea for people to ride motorcycles without helmets? No, but they've got the right to do that. It's just not, it's not a good idea. I would even say that about bicycles. You should wear a bike helmet, but we can't make people do that. Just like with seatbelt laws, there's law, it saves lives, but some people choose not to do it. And, some people choose not to adhere to the speed limit. And, we know that the faster you go, the more chance, less time you have to react to some untoward event, and the more likely you're going to have a wreck. And if you have a wreck going really fast, the likelihood of causing more damage is higher. So it doesn't absolutely prevent, even if you go 50 miles an hour and wear a seatbelt and have airbags, it doesn't prevent you from from getting killed in an automobile accident. It just lowers the chance that you're going to get killed versus going 100 miles an hour with no seatbelt and drinking while you're driving. So that's where I see the vaccine.
Yeah.
It won't absolutely, there's no panacea and guarantee for everything. just lowers the risk of going into the hospital, getting a tube put down your throat, and never getting off the ventilator. Lowers that risk. So just get a vaccine.
Yep. Yeah, I think that once again, all the reasons that you gave there, those examples, and then you add smoking in, which we've dealt with for, quite a while now. Again, that individual right starts to butt up against the right of society to be healthy. And, for the smoker who chooses to continue smoking, who pays for their healthcare in the future, all of those things that we've discussed already. And COVID is just another one. And it's the tough one because we do honor and respect the right of that individual, but your decision may adversely affect your family, your community, your nation, cost, and all the things that we've mentioned. And that's what we struggle with in democracy every day.
Yeah, I just since you brought smoking up, you've triggered me. Probably the worst thing you could do to your body.
Yep.
I don't know. Maybe driving 100 miles an hour, drinking without a seatbelt is worse than smoking. But over the lifetime, smoking, very bad. Cardiovascular, cancer, all kind of things. So let's not get diverted. We got other questions. Holly, what else you got?
I like today's PSA on no smoking. We have one question from Sean Meixner from the Arizona Daily Wildcat, and he says, the United Campus Workers of Arizona held a demonstration this past Friday, October 1st, outside of the administration building here on campus, where they presented a list of demands, including a vaccine mandate, mandatory COVID testing, remote learning teaching options, and hazard pay. Does the university intend to answer any of the union's demands?
Yeah, I'll look at those. You just read them, and I think I've talked about each one of them, but we'll put it in writing and get it back and have a dialogue and discussion with them. But I think these are all valid things to have a dialogue about and a discussion. Given the constraints that we live in this politically divided world. So the answer is yes.
Great. And those are all the questions we have. Would you like to close us out? Any further comments?
Well, I would offer Dr. Cullen the chance to say any closing thoughts about all the things that we've been talking about, or what you would hope. I guess I don't want to. I mean, we're supposed to be wrapping this up right now. I know you've got places to go, but what people want to know, and again, it gets into the prognostication business, and none of us are very good at that. But when is this all going to be over? Right. When can we get back? When are we going to see that downward side of the curve that you described earlier? And that's not really a question, but comment on anything you want to comment on as we close out here.
Well, I do want to make a few comments, and I'm not prognosticating anymore because every time I've done it, I've been wrong. There is some hope that as we go into the winter, we will see decreasing cases throughout the country. But, there are success stories throughout the country, and many of those success stories are related a lot to what you and Dr. Carmona talked about, which is the community will, the willingness of the community to really commit to an overarching vaccine initiative that would increase our vaccination rate. So I want to let people know that there are places that are not in high transmission, that are in moderate transmission, that have been able to have 42,000 people at a ball game and nobody worries about it because the vaccination rates are so high. And I believe for us, it's not just this 10% of people that may be pretty stalwart in their commitment to not get vaccinated. As a public health agency, we have a commitment from the county to make sure that we can get that 67%, 77% up to 90. If you think of that 10% that's going to be up here, well, that still gets us to 90%, even if those people don't vaccinate. So my commitment from the county and our commitment from our Board of Supervisors and from an administrator, and I think I can speak for them, is that we are trying to do everything we can to reach those people. And I also want to caution people that It's easy to be pejorative and judgmental of people that haven't vaccinated. Some people haven't vaccinated because they're still really scared, or they don't have a car, or access there is an issue, or they're working 3 jobs and they're worried if they get the vaccine, if they're going to have side effects, what will happen. So our commitment is to work with that segment of our population to make sure that we can increase our vaccination rates. And I never want to not say how awesome it is to be an ongoing partner with the university. The university has continued to work closely with us to enable us to remember you provided a lot of vaccination for the community, and I think it's really important that we call you out and say thank you, and we look forward to continuing to work with you.
Rich?
I'm good, Bobby. I think all has been said that had to be said, and we're very grateful that the county's been such a great partner, and it's always good to work with Dr. Cullen.
Yeah, and I would say, you have an open invitation anytime you've got things to say to the university community's audience. Please come back. We love having you here, and thank you for making it so easy to work with the county. And I would say it's been easy for us working with the state. A lot of that has to do with your good relationship with the state as well. So big week this week at the University of Arizona, family weekend. There are families that are coming into town to see their students. There'll be a lot of activities. I would just ask people, try to keep your mask on. Just put it on all the time. And even if you're outside, it's good for preventing sunburn and skin cancer. But I know that there are going to be a lot of people here this week. We keep watching every time. We said after the Labor Day holiday, after the first 2 home football games, we're going to see this big spike. And for the most part, it's not been as bad as last year. But as we go out this week and we think about that theme of compassion and think about those people who are getting sick, just keep them in mind, and please do all the public health measures we're asking you to continuously now for almost 2 years, and make sure that you always mask up, vax up, and as always, bear down. We'll see you next week. Have a wonderful week, everyone. Thank you, Dr. Cullen.